All right, everyone. Good afternoon, and welcome to our session on refugees, forced migration, and primary care. We're very happy you're here. First, a few housekeeping items that you have already heard several times, but just going over it again. All attendees are muted and are encouraged to use the Q&A box to ask questions. Raise your hand or use the chat if you need technical assistance. We offer dental, medical, nursing, public health, CHES, and MCHES continuing education credits, and to receive credits, you must complete the surveys. The survey link will be posted at the end of each session, and dental, medical, and nursing credits are offered at the session level and required submission for each session. For public health and CHES, MCHES credits, those are offered only for the full day symposium and require only one survey submission. So our speaker today is Dr. Douglas Bishop. Dr. Bishop earned his Bachelor's of Arts degree from Amherst College and his Doctor of Medicine degree from the University of Medicine and Dentistry of New Jersey, Robert Wood Johnson Medical School. He completed his family medicine residency at Thomas Jefferson University Hospital in Philadelphia, where he volunteered as the resident director of the Jefferson Refugee Clinic. Dr. Bishop joined Zufall as a family physician in 2010 and has dedicated his professional career to the care of patients who are under-resourced and underrepresented. First as a clinical lead in Morristown and currently as the Senior Vice President of Medical Services. One of his talents is action through connections. He loves to read and he likes to teach too. He holds numerous distinctions, including several faculty teaching awards, the Arnold P. Gold Humanism in Medicine Honor Society, and the Lester Z. Lieberman Humanism in Medicine Award. At the conclusion of this session, participants will be able to define and differentiate between refugee, asylum seekers, and other types of migrants, introduce the umbrella term of forced migration as a concept to understand certain immigration patterns to the US, and explain the importance of nuanced understanding of immigration to providing optimal primary care to vulnerable communities. Dr. Bishop.
Hi, thanks so much for the introduction. Sorry if my background appears in reverse here. And thanks for coming and hearing about this. This was a talk that I agreed to do over the summer, and things have changed quite a bit, I think, in the last weeks here regarding the national discussions around immigration, and hopefully that doesn't really change how we think about this as clinicians. So let's get going. Thanks. Go to the next slide. And we went through these objectives. I also hope to confuse you a little bit here. I think this is something, if we are talking about immigration and not being confused in this country, I think we're not really doing it justice. So that I hope to have made some good confusion in your brains here. So we'll go to the next slide. Thanks. Anyone who's seen me give an immigration talk before, and some of you may have, I always start with this quote, which I will read. Few of their children in the country learn English. The signs in our streets have inscriptions in both languages. Unless the stream of their importation could be turned away, they will soon so outnumber us that all the advantages we have will not be able to preserve our language, and even our government will become precarious. I usually ask if people know where this is from. I will tell you it is from Ben Franklin in 1753, talking about German migration to Philadelphia. So immigration has been a contentious issue for longer than we've been a country. And I think having that historical perspective is really helpful, particularly in these very trying times that we're in right now. Go to the next slide. So why are we talking about this? I think obviously the election results have put mass deportation onto the national agenda. This will be certainly seeing changes with immigration policy. I think the border crisis was something that was talked a lot about in the past years and has influenced people's views one way or another. The other reason is the United States is a country of immigrants. We are the #1 country in the world in terms of foreign-born population. There's over 46 million people here who were born outside of the United States. And interestingly, that's greater than the next 4 countries combined, which are Germany, Saudi Arabia, Russia, and the UK. Again, we're not the highest per capita, but far and away, there are more foreign-born folks living in this country than any other country in the world. And if you take a look at the sort of graph here, that 15%, so the lighter shaded line there, was the same in 1870. And so we have been a country of people who were not born in this country for a very, very long time, and you know, some of the same battles we keep seeming to fight here. Next slide. For just completeness sake, I thought this was interesting. There are other countries that have way higher percentages of foreign-born populations. I was not aware of any of this. I thought this was just interesting. There's many Middle Eastern countries have majority foreign-born. Well, several have majority foreign-born populations. Australia and Switzerland, also Canada, have higher per capita foreign-born residents than the United States does. Next slide. So talking about New Jersey, which where I am currently, where many of you may be, but just as an example of how this kind of drills down to a more local level really quickly. The immigrant population in New Jersey is 23.5%. California has the highest of any of any state in the country. New York and Florida are also very high foreign-born populations. Of that, about 11% of New Jersey residents are naturalized citizens, and about half of these were foreign-born. We do have also about 500,000 both refugees who are currently in process and green card holders. It's about 500,000 undocumented immigrants in New Jersey currently, many of them younger, so about 90,000 or so under the age of 24. We'll go through that in a little more detail. I think it's interesting to kind of drill down even more on that. There's a map here just showing where these folks are. All over New Jersey is really the answer. This is a country with a lot of people from everywhere. Next slide. And at Zufall, I think it was worth talking a little bit about this, just as in terms of our own view as a health center that is taking care of the communities that don't always have great access. A lot of these folks are coming from other countries, and it's interesting to think about what we know about them, both purposely and I think what we don't know about them purposely. We don't really track foreign-born patients. You can infer some things from some of the documents that we collect and some of the information that we collect about who is from which country. We ask, but we don't write it down in the electronic medical record where people are from. It's on some of our paper forms, and we do not obviously keep records of a documentation status. We had 48,000 patients in 2023. About 70% prefer a language other than English. About 50% are uninsured. A lot of those we know are undocumented folks. So I think the question is, like, how many of our patients are foreign-born? And I don't think we have a clear answer to that. I think a lot. I would say over half. What are the primary countries of origin? I think we know just by, if you're doing ground level patient care, you know from your patients, like where they're coming from and what languages they speak. But we don't, again, really keep track of this and how many of our patients are undocumented or classic refugees, I would say, and how many are forced migrants, which we'll talk a little bit more about later. And then our staff members and families. Many people were not born in the United States. Many of us have family members who were not born in the United States as well. And sometimes those are mixed status families. Some folks are here with citizenship and other forms of status. So next slide. Just to go through some definitions. This is from the US government. An immigrant is considered to be a foreign-born resident who is not a US citizen. They are lawfully admitted for permanent residence. So there are folks who are going to get green cards or have a green card or are in process for that. A refugee is, I think, a definition people probably have heard before, is a person who has fled their country of origin because of past persecution or a well-founded fear of persecution, and that is based on something about them, their race, their religion, their nationality, their political opinions, their membership within a group. That has included in the past being a woman. And asylee is similar to refugee, but it is an immigrant who is already present in the United States. So next slide. And so this is the United Nations, which again has slightly different ways of thinking about this. They also throw in the term migrant, which does not have a legal definition under international law. These are folks that are perceived to be able to return safely home, and they're sort of voluntarily moving between countries. And then again, refugees and asylees. There are people who become refugees within neighboring countries and are sort of going further away for sort of permanent acceptance. There are people who are internally displaced refugees that are within their own countries, can be sort of walled off from the rest of the country. And referring to individuals who are likely asylum seekers or refugees as migrants can undermine their legal protections, and is something the United Nations likes to point out. So you can go to the next slide. And then another question, which I'm not gonna have a great answer for, is what do we call folks who are not lawfully admitted to the United States? And there's a couple ways that people become that way. One is a border crossing, and that's the one that people are most familiar with. The other is overstaying a visa. The terms that are commonly used here are undocumented immigrants, illegal aliens, unauthorized immigrants, migrants, economic migrants or migrant workers, non-citizens, and undocumented non-citizens. If you look at style guides and sort of editorial decisions made by what used to be called newspapers, I guess media organizations, they will have rules around how they do this. Some of them will flip back and forth between using different ones. I think the sort of bias of a news organization may also have them using one term or another. And I'm not going to give an answer for this. I think it's worth sort of thinking deeply about this kind of question and the words that we use to describe our patients and people in our communities. In New Jersey, I mentioned this before. I think it's worth just breaking this out a little bit. This is recent data of the unauthorized population in New Jersey. Again, a lot of folks from Latin America. However, a lot, 55,000 undocumented residents from India, which is the second highest group. And this is maybe not the face of undocumented immigrants that is always put out there. There are 16,000 from Europe and Canada and from Australia, New Zealand. Almost 100,000 from Asia. So very interesting to really peer at the details here. And one of the wonderful things about doing care for immigrants as healthcare providers, you don't have to like worry about the politics of this. You get to take care of the people that are in front of you and really try to do the best for them. And I think this has the potential to be very broadening, very centering experience for all of us. And understanding the complexity of it and understanding that there are folks coming from all over the world, and you know, they may be in your dental chair or your medical office, and sort of viewing them as people and not statistics here, I think is a really useful step here. So the next slide, please. Right now, this is from the United Nations and the US Department of State. There's 110 million people forcibly displaced. That's the highest in history. And second highest was World War II and the aftermath of that. So there are about 2.4 million refugees in need of resettlement. The US government has led on this issue in many ways. The US accepts more refugees than any country in the world. Again, not more per capita, but more refugees. And that is something that has been done for many, many decades across many different administrations. The resettlement provides safety, dignity, and a new start. And that's a direct quote from the US Department of State. Next slide, please. So after going through lots of definitions and talking about refugees, asylees, 8 different terms for folks who are not here with legal status. I'm gonna tell you that maybe it doesn't even matter from the perspective of the clinician and the perspective of the folks working within healthcare. I think understanding a lot of this as forced migration can be very helpful. And these are folks that are moving not because they want to, but because they have to. There are many, many causes to this. I think the most common things you think about are conflict induced, right? Folks leaving Ukraine. Other places in the world that are involved with conflicts. There's disaster induced, right? There's floods in eastern Spain, right? And then people have to leave. They have to go somewhere else. Development induced, right? Like you can no longer afford to live where you are. There has been some changes to where you live. You have to go. And climate change is increasingly something that we're seeing, where people's ability to survive, to grow the crops they used to grow doesn't exist anymore. Maybe the business that you had before doesn't exist anymore. Maybe your home or your island is underwater now and you have to leave. And these are things that we're going to be dealing with. And again, types of forced migrants, there are refugees, asylum seekers. We talked about internally displaced persons, which are refugees within their own country. And then economic migrants. And again, there's a lot of overlap between folks who are immigrating for a better life and folks who are really forced by economic circumstances to do that, folks that are forced by other circumstances to do that. So we're not going to be able to figure this out for everybody, and I don't know that you have to. I think just recognizing that there's a significance to the fact that people have moved is enough. You can go to the next slide. Just wanted to break out U.S. refugee arrivals. This is not actually the whole year. We did this maybe 6 weeks ago, and just to look at where people are coming as actual official refugees to this country. A lot from Africa, a lot from Afghanistan, Syria, Venezuela, increasingly more from Central America, and then Eritrea, Sudan, Burma. These are this is a very diverse group of folks who are coming into the country. And again, the refugees are spread out throughout the country. You can go to the next slide. New Jersey refugees, and again, we run a refugee program here where we help to do initial medical examinations for newly arrived refugees, and we've been seeing this similarly in our own office. A lot from Venezuela, a lot from Central America, but again, many folks from Syria, Afghanistan, and many other countries. So a diverse group of folks who are being admitted to the United States. Go to the next slide, please. And something that is outside. So the refugee programs are congressionally mandated. There's about 100,000 refugees accepted under a very, very formal process every year. There are supplemental refugee programs that have happened because of other crises happening worldwide. The United States has accepted over 100,000 Ukrainian refugees since 2022 outside of the normal refugee process. They've accepted about 100,000 folks from Afghanistan, and then about 500,000 from Haiti, Cuba, and from Venezuela, and coming in as refugees, forced migrants outside of the normal refugee process. And that's been over about the past 2 or 3 years. Go to the next slide. And also Southwest border, this is something that we see a lot, are unaccompanied children, family arrivals. Recently, we have a lot of Central American folks who live in our communities in New Jersey. Just to look at the numbers, about 100,000 unaccompanied children came last year, about 800,000 family arrivals. Half those are probably kids, and 1.2 million, 1.2 million single adults who were picked up at the border asking for asylum. And this has been relatively steady over the past few years. So about 2 million a year over the past 4 years here. And next slide. Go next slide. Yeah, thanks. Sorry, go back. So the complexity here of this whole process is what I meant about being confused. immigration's hard, it's complex. Just to like add up our numbers here, the United States accepts about 100,000 refugees, and those are the folks who come through a very formal process. They accept about 300,000 in the past several years from these extra programs from Ukraine, Afghanistan, Cuba, Haiti, Venezuela. And then there's a lot of people coming to the border, and a couple million, and it's hard to not view those folks as refugees seeking refuge. And then there's other folks that we don't even know about, right? This is part of the undocumented population, is they're not documented, right? You don't really know how many people here, where they are, who they are. And then there's other documented folks, right? That maybe are forced migrants who are able to get out of the country, who can get a visa, can get an ability to come here in a more formal way. You can go to the next slide. And so, defining what's a refugee, I think is complex. And I think we want to, when we see immigrants and folks who are here, sort of assume best intentions, and really try to try to do the best we can for everybody who's here. Go to the next slide. And this is really, I think, the key point that I was trying to make here is just going through some quick cases here, right? These are people that anyone doing primary care at Zufall has seen, right? A 17-year-old arrived from Honduras 2 months ago and comes in for school physical. She came to the border by herself. She's an unaccompanied minor. She actually has a pretty good chance of getting immigration relief if she can get a lawyer, because there are the way the law is written now allows her pretty easy access to asylum if she can get her case together and really get a lawyer. She's fleeing gang violence, lack of economic prospects, right? You get a 24-year-old comes in for a positive pregnancy test, didn't interact with anybody at Border Patrol, just sort of arrived here. She's fleeing gang violence, lack of economic prospects. A 24-year-old woman coming in for a sick visit, came with her 5-year-old daughter, was briefly detained at the border and then released. Again, a family arrival to the border, fleeing gang violence, lack of economic prospects. And then somebody who comes formally as a refugee, one of these sort of Honduras refugee arrivals, already had domestic health screen, had some vetting done previously in Honduras, fleeing gang violence, lack of economic prospects. These are the same really push-pull factors for people, and mostly push factors that are making folks need to migrate. And they're arriving with very different statuses, with very different abilities to access future legal status here. So a framework here for understanding and responding. I think trauma-informed care, you're hearing a lot about this. This is fundamental to what we do. Cultural humility, which is different from cultural competence, right? It's really just showing respect for diverse backgrounds and experiences. Empathizing, I think we're all in healthcare because we have some measure of empathy. If not, you'd probably be doing something else. And you certainly wouldn't be at this conference here. So I think we all have this. And I would say two other things. Examining migration within its broader historical context is very, very helpful for me, and perhaps for you. This is a moment in time. The time course is large for this country, and there will be something else happening in the future. Also, forced migration, just to sort of tie everything together, can be helpful. And next slide. And then the last thing here, this is something that's nice. It's on the wall at Ellis Island, which is not so far from here. And it's a quote that I really like, is it's an old Italian story, is an immigrant saying, "Well, I came to America because I heard the streets were paved with gold. When I got here, I learned three things. First, the streets weren't paved with gold. Second, they weren't paved at all. And third, I was expected to pave them." And I think that's what this country is we've been founded by immigrants. We are, we're just in another wave of that right now. So thanks for your attention, and I may have run a little bit long.
Thank you so much, Dr. Bishop. I think we have 1 minute, but thank you. This is such a timely discussion. And thank you for the definitions. I think it just puts everything in perspective. There's one question in terms of, I know it's hard to predict, but what effect do you see of this new administration having on forced migration?
The refugee program itself will probably be scaled back, if not dismantled. That happened at the last time. They went down to about 10,000 refugees accepted per year, from about 100,000 during the Obama administration. those attempts will be made. Obviously, deportations are on the agenda here. Forced migration is not going to stop, right? Like people will have a need to leave their homeland, to come to places where there are opportunities. America is always going to be that. So I don't see it really stopping forced migration. It'll just happen in different ways.
All right, so thank you so much. We're run out of time, but this is wonderful so much. We have some questions that we can then forward you to on the chat so you can see if we can answer them for everybody. All right, thank you again. I think we're going to the next session. Fill out your survey, please, and be well.